With Thanksgiving tomorrow and COVID still lingering, some of you may have real safety concerns. Well, Cook County Health's Dr. Mark Loafman is here now to talk about that as much as we can get into it. Doctor, thanks for being with us tonight. How are you?
I'm doing great, Ray. Thanks for having me, and thanks for keeping this topic on the front burner.
Well, we felt like we had to do that here. Let's talk about, we're all thankful that the vaccines are out there, and it's giving us the ability to at least get a handle on ending this pandemic here. How do you feel about where the vaccination rates are right now heading into the end of the year?
Well, some areas we're really happy. Chicago area, we're doing pretty well. Some places it's only around 50 or 60%, which is not enough. So we need to get more vaccines and more arms. The sooner the better.
That's been the marching drumbeat, hasn't it?
Yes.
Talk about holiday gatherings and people gathering together in indoor spaces once again. What are your concerns? I'm guessing they are not as severe as they were last Thanksgiving.
Well, yeah, we have so much to be thankful for this year, right? It's very different than last year. And again, people that are vaccinated, and if you're due for a booster, you're boosted, get together in small groups and gatherings. I think we can look forward to that, and we've earned that. It's those who aren't vaccinated and in the large gatherings that are going to cause problems.
What would be your advice if you're gathering with relatives? Maybe you've got that one uncle or aunt who is hesitant, or maybe at this point just flat out against any vaccines. How do you handle your own personal health and safety around that relative, and how do you interact with them?
It's a great question, one we hear often, and I think we say let the guidelines do the heavy lifting. It's not that host versus the guest. It's really the guest versus the guidelines. And so, you know, the host should be happy to have people come and follow the guidelines. If they're not able to follow the guidelines, it's like any other safety hazard. A host really should not participate in having a safety hazard for their other guests.
Do you think that this has been a launching conversation for some people that, you know, if they've been holding out for whatever reason and they see, you know, where the rates are and like maybe this is their one opportunity. If I'm going to get together with family, this is the only way that I'm going to do it. Do you see that trend starting to happen?
Absolutely. The mandates and family gatherings are really tipping the scale in favor of vaccination. And the thing I think to help people along is rather than argue with them specifically, reminisce about other previous public health campaigns like seatbelts and indoor smoking that seemed like huge lifts, but we got through them and now they're routine, and this will be routine as well. So try to use those external factors as a way to influence rather than have an argument with the person yourself.
How do you feel about, you know, masks indoors at this point? What about COVID tests before your gathering?
Yes, COVID testing is readily available now and pretty affordable and actually pretty good. So that is one option, especially for people that aren't vaccinated. Or if someone in that house is immunocompromised and at risk, you really want to be sure no one brings COVID into that room. So that's good. And masking too, we still follow the rules. It's hard to imagine a family getting together around the Thanksgiving table with a mask. It's not going to work, right? So we have to be creative about spacing, using outdoors and other things to try to limit the contact time in close quarters.
Have you had a tough time trying to, you know, do your own part as a physician to sort of dispel the myths? What are some of the lingering ones that really are just, I don't know, a head scratcher for you?
Yeah, I mean, we spend an inordinate amount of time every day talking to people about this, and that was necessary in the early months. It's getting old now. We have other health conditions to treat and take care of, and we're ready to move on. So I think, you know, the myths that continue to be around are vaccine safety, that it hasn't been around long enough, that it was rushed to the market, that somehow it changes things in a way. And I think people that understand the immune system, our immune systems are capable of managing that no problem. Right. So that's a big myth, and it's very disturbing to continue to have that. Vaccines are the way out of this.
What would be your lasting advice? I mean, beyond go get a vaccine to somebody who is not vaccinated for whatever reason, and they're going to be around other people. What's your advice to them?
You know, I think I just would ask them to think about the community and have some gratitude and understanding. You can make a personal choice to not accept this yourself, but in interacting with others in a threatening way, you're potentially a lethal weapon. And that's really a lot of responsibility to put on. So I think it's one thing to deny access to this yourself, but to then therefore put other people at risk. Using a family gathering to put them at risk is really it's not responsible. And I think that's the part we'd ask people. Again, let the guidelines communicate that message to people. Let the protection for immunocompromised or or elderly family members at home, let that do the heavy lifting as well to get that message out.
Dr. Mark Lofen, I'm glad we got to talk with you at Cook County Health. Thanks for your time. Hope you have a wonderful Thanksgiving.
Thank you. Thanks. Happy Thanksgiving to you as well.
All right, take care.
Bye-bye.
Let's take another look at the roads from Sky